Well, hello. My name is James Black, and today we're going to be talking about blockchain in healthcare, which is pretty helpful because today was also when Amazon, JP Morgan, and Berkshire Hathaway had announced that they're going to be trying to disrupt healthcare. So let's talk about healthcare. Okay, because I'll just have, okay. So the purpose of healthcare, people go into healthcare with the idea of they want to have the best quality of life. They want to be able to help give the best quality of life to people given whatever their situation is. So people in hospice who are going to be dying, you want to give them the best quality of life. Um, Different people are in different situations, and that's really why people go into healthcare. But it helps to try and have a healthier population because the fewer times people get sick, the healthier they are, the more energy they have, the more creative they are, and overall it's better for the country. We also want to try and find new treatments and medication. This is a big part of it, is to do that. So we also, but it's profit driven. You need to have profit in healthcare, so you want to try to always reduce costs and maximize profits. And so we're going to be looking at these. So first, why blockchain? So I'll be doing another talk on more about what is blockchain, but today we're just going to be looking at this. Um, you can improve claims acceptance by using blockchain because if the payer and the if the insurance company and the doctor, for example, are in agreement, so the doctor says I need to do this, and then the insurance company says, okay, we approve of that before it's done, then the doctor's claims could be much faster. Um, by having more transparency, then you don't have to have audits of the doctors or the insurance companies because the regulators already know what's going on. The patient, everyone knows what's going on. So the fraud rate goes down because the patient can say, well, I never actually got that service, so why is it being charged? Um, if you own your data, and this is a big part of blockchain, a big idea that was brought up due to blockchain is who owns your data? We upload videos to YouTube. We have images on Facebook. YouTube and Facebook own those images. They can do with them what they want. Who owns your medical data? Again, I go back to remember it's important to try and find new treatments and new medications. So the pharmacy companies want to have access to more medical data. Why shouldn't some of my money go to the doctors or to the patients? You may have a rare condition, and it might be worth more to the pharmacy companies to actually get your data. So why not have a little income from that? By using blockchain applications, you can also create opportunities for new tools. So we're going to be doing analytics. We're going to be trying to analyze data in different ways. There's new opportunities. You can enable, so I've probably had 20 different doctors in my life. My records are scattered everywhere. It would be nice if they could all be brought together so I could see them all at one time because then someone could come up with a machine learning algorithm that could look through my records and say, well, you've been getting treated for this, but really if they did this, you'd probably be healthier. You can reduce costs just by getting rid of the middlemen. I mean, it's kind of a given that if the doctor sends the information to a middleman who then has to do his part, well, he has to add some money to the cost, and then it might go to another middleman who does his part, more money. And then you have, by the time the insurance company gets it, It's much bigger than it should be due to all these middlemen, so we could get rid of the middlemen, reduce the costs. And you also reduce costs by simply simplifying how the data is transferred. So a big part of this is we could speed up claim, we can make certain things, everything's more transparent, and we can reduce costs. So we're helping the overall healthcare system. Okay, so when I talk about a blockchain, really what it is if you look at a Excel spreadsheet, for example, in this case you have just a patient saw this doctor on this date and time, and there was some reason, and they saw two. Now, in any system right now that's centralized, I could go in and I could change what doctor I saw. So a hospital might decide to change who the doctor was because you're trying to sue and say, well, this doctor did something improper. And they could change who it was, and so that way you can't really go and challenge it too easily. Since they control the data, there's nothing to stop them from changing data. Hence the reason why we have all these logs, we have a lot of HIPAA regulations in order to try and make certain this doesn't happen. But we had to put a lot of extra processes in place to try and make certain that the healthcare system stays honest. So what you do is you just say, okay, well, I'm going to have this, and then what I'm going to do is I'm going to add up all of these values, for example, and I'm going to have a hash value. So I turned all of these values into a string, into a number. If you change anything in here, then this value will change. So I had saved the previous hash of the previous row, and this number goes down to here for the next patient. This is what a blockchain is. So these are all blocks. This entire row is a block. We have the hash, and we just chain them together. So you would keep on having more and more, and this hash would keep on going down each time. So also, if you change the hash, it should change. If I change anything in this should change. So it helps to keep everything, again, more honest, because I can't change anything and not expect the hash to change. So that's what a blockchain is. Okay, so let's look at how a healthcare system could work. Now, I'm not going to be talking about all of this, but this was me one day just brainstorming. So you go to a portal, your phone, whatever, and you want to make an appointment. So you talk on your phone and say, I want to see Dr. Watson because I lost my cat. The phone then turns that speech into text. It then takes the reason, gets sent over to the doctor's office. They'll turn that into codes. You get your appointment. It can make certain that you start with an appointment. It starts then looking at what doctors, and so this way of making an appointment can be fairly complicated. We could have a lot of machine learning involved in this. I'm not going to talk about that. But what I am going to be talking more about is just this idea of from the time you get checked in until you see Doctor 1, Doctor 2, pharmacist, you see another doctor, we're going to be talking about that approach. But in this overall system, you could have nurses could be seeing you, so they take your blood pressure, they put information on the blockchain. The doctor sees you, they put information on the blockchain. This blockchain is also being sent to the insurance company. They're part of it. You have a bunch of different bits of data going into this blockchain. And that's actually what we're going to be talking about. We're not going to deal with money. We're not going to be dealing with other parts. But like you see in that diagram, you can have different blockchains. So for example, again, we go back to you have this medical encounter. So you saw the nurse, you saw the doctor, you see another doctor, you go to a lab, you go to the pharmacist. These are all medical encounters. That's one use case for how you can go through the healthcare system. The doctor submits the claims, the charges to the insurance company. That's another approach. Personally, I think that if we do this properly, this could be streamlined and very quick, but this would require another blockchain. And then you have the doctor or the insurance company giving money back to the provider. The insurance companies provide the money for the entire system to work. So we pay our premiums, the employers pay the premiums, the government pays. Ultimately, the insurance companies are the things that make the entire healthcare system work. So this I would actually use Ripple for. RippleNet is a nice blockchain-like approach. They're really good about doing financial transactions. And then you can also have, like I was showing, about getting an appointment. So you can have all these different types of blockchains. But each blockchain should have one purpose. You shouldn't have one blockchain that tries to do everything, because then it gets to be overly complicated. It'll get boggy. It won't do its job very well. So that's a big deal. Okay, so like I said, for remuneration, you would RippleNet is generally less than 4 seconds settlement time. So from the time the insurance company says transfer money from here to here, in less than 4 seconds, it's in a doctor's account. Right now, there's long delays a lot of times because there's issues on claims. The doctor will say, well, here's the charge. The insurance company will say, no, we don't want to pay that much. And then you have this back and forth, and we could try and streamline that with blockchains. So this is where we go back to the provider. They wrap up all the charges for your visit. They submit it. There's all kinds of information as to how it can actually be done, because it might be that for having a MRI, it's a set cost based on the contract. It could be that you have to pay your deductible, then they pay this amount. There's all kinds of different rules. And the insurance company has to keep track of all this and know what is the proper amount at that time. So that gets to be very complicated. So we're talking about the treatment path. The reason why people go into medicine. They want to make people feel better. So I look at it as from the time that you get signed into the provider, you went to your pharmacist, you said, I'm here to get a prescription. That's you signing into that provider until they say, okay, here's your medicine, you pay and you leave. Then you have, so if you group all of these together, I call it a treatment path. And it might be that your symptoms never actually got resolved. It might be that whatever is happening to you is chronic, but until they decide you're done. And then, like I said, creating appointments, very complex, multiple, more than one blockchains involved, lots of machine learning. But to do this properly, you should always have at least 2 approvals. The doctor and the patient should both agree that on the appointment, on any changes to the appointment, nothing should be held in saying, yes, this appointment is ready, is set, unless you have two approvals. So your blockchain should allow you to say it's only going to be valid if we have both. Okay, so here's some pain points in healthcare. You go on a trip. You went to Hawaii. You ended up injuring yourself, so the doctor gave you a prescription, and then you go to your pharmacist. You get another prescription for something else. They don't know if there's going to be any conflicts due to the um, other prescription because they don't see it in their system because you didn't go to your normal pharmacist stores. So that's a problem. You had tests done in Hawaii. You come to see your doctor. They'll probably have the same test done back home because they can't easily see the system and to see the data. Sometimes they can fax and get it, but often it's just faster just to send you to radiology and have them get another x-ray. So, and then you also have the fact that doctors can, if they're asked to share information, they may not get any money, and they have no control. So once they send your medical record somewhere, it's lost control. So, so we have these different pain points. So then we have some questions. So for example, for a given symptom, for a given patient, can you come with a different diagnosis if you look at their entire history? So you may find that 2 or 3 times a year this patient has certain symptoms that will actually lead you to understanding, oh, this is actually their problem. But because it happens over such a long time span, you may not realize these things are connected. And for a given symptom, is it possible to determine certain tests, if you gave them earlier, it would reduce the cost? So for example, if you follow the standard procedures, you might need to do test A, test B, and test C because test C is more expensive. But in actuality, everyone gets you to C, and then they get the real result. And then they can tell you what's going on. So why pay for test A and test B if you're just going to be going to C anyway? So if you could look at a large number of treatment paths, you could see, is there more of these places where we could save money? Okay, so in this blockchain approach, the appointment's already made. Went through all the complexity of making appointments. We're going to be looking at each stage of each medical encounter. It's going to get entered. We're going to know when you enter each stage. So you went and you see the nurse. That's one stage. How much time you spent in the nurse, and then when you leave. These are 3 different times. So, that way you can see how long you waited for the nurse, how long you waited for the doctor, how long you actually spent with the doctor. You can know what kind of tests and supplies were used. And based on the HPCPS code, you can understand why something was done. So we can get various information through this approach. So here's my little diagram of my fancy graphics. You have the appointments made, you check in. Then you go see the nurse, you update the blockchain. They get temperature, pulse, blood pressure, you may put that in the blockchain. Now in this blockchain, you're only known as patient 87621. That's the only thing in there about you. The doctor would have to turn that into who you really are. So they only know you by a code. So it's less data that can be leaked because at the end of the day, the insurance company also is only getting to know the codes. They don't actually know who you are by going through this part. They'll know you by the charges. Okay, so then you see the doctor. So all this information is constantly going to the blockchain. You get checked out. Do you need a prescription? Yes. They put that in the chain. You need a new appointment. You could go through the whole system and make an appointment. So that's the basic flow. So now I start looking at, okay, fine. So you need to create and update appointments. So we're going to go with the fact that, again, the appointment's already made. So someone was authorized to create an appointment. So all they're doing is that's entering into the blockchain that you have an appointment. So you're seeing this doctor on this date and time. And a patient can only make appointments for themselves. So you have certain rules. And you have to assume the appointment is valid. Remember, you have to have 2 people agree. So this starts setting up what are the rules. You have permissions. Not everyone can put in appointments. I can't make an appointment for a coworker. And it might be that you can be limited to only certain doctors also. So so the system has to be able to adapt to these different rules. Okay, so the data that's stored, like I said, we have a blockchain ID. Everyone's going to have an ID on the blockchain. It's a way for the blockchain to know who you are, because different doctors will have different keys, IDs for you. You also have a public key for the patient, and you also have a private key. So the patient keeps the private key, the blockchain knows the public key. So that way they can encrypt data and keep everything safe. And then you also have the EMR ID and a provider ID. So that's the same ID. But for every doctor or for every system, you would probably have a different ID. For the doctor, we just have a blockchain ID and then just a public and private key pair. In this case, I made it really simple. We don't have doctors' names, nothing else. We just know doctor with this ID has seen these people. So for each medical encounter, we have the test name, we have the supplies used, we have the various codes. That's all we may know. We may also have some other additional information as to temperature, pulse, information like that. Okay, so then you get checked in. The system looks to try and get the blockchain ID for the person, because this is the unique ID for you for the system. If they so the doctor's office would have to know what the blockchain ID is for you. If they don't have it, now they're going to have to go send your ID to the blockchain. The blockchain will then have to get the correct, they'll have to sync up your blockchain ID to your actual ID. And then they will change your status to checked in. All these deductibles and everything, that's outside the scope. We're not worrying about that. So now the system knows who you are, and your new status is that you're checked in. Okay, so then we have the update stage. So you're going to see some medical staff member, so your status could be changed to involved. And then it just keeps on going through the different stages until you're done. And whatever within reason that is done is actually also included in a blockchain. Like you're not going to say, well, I use 3 Q-tips. But you may say you use Q-tips, for example. So it's kind of within reason as to what you'd actually put on the blockchain. But that might require them to have this tied into the inventory system. So as the doctor is going through, they could be keeping track. But you don't want to make it too burdensome to the doctor either. You need a way to be able to add patients and providers. So ultimately, you want to have a national blockchain with biometric data so you can uniquely identify every person. Unfortunately, if someone's visiting from Germany here, they won't be on our blockchain. That leads to other problems, but this is outside the scope anyway. And we also need to have a way to certify to say, for this doctor, here's all of his certifications, here's the dates that he was valid, so that way you're not making appointments with doctors that are no longer certified. And people can look this information up easily. Then you have the checkout. And this is where you might end up putting in prescriptions, and the prescription would actually be put into referred to the pharmacy, for example. So that way, again, the pharmacist could then look up what are all the prescriptions that you currently have. And it's not just by them, it's anyone's prescription. Now, all the prescriptions for you. You could put in information about referrals, follow-up appointments. So you could have different information on the blockchain. It's all about your status. What is your current status? So here, then we look at some use cases. So a doctor needs a test result. So in this case, the doctor just submits a request to the blockchain. An event is sent out to let the patient and the doctor know. The doctor that had originally gotten it, so I was in Hawaii, I got injured, that doctor gets informed. This information is all encrypted, and then one of these two, so either the doctor that I saw in Hawaii or I need to say yes, I approve this to be sent to that doctor. So that way it can we have control over that data. You can't just make requests and say, well, I want to see JLo's last physical. Because JLo would have to approve it. She'd say, well, I have no idea who this doctor is. And she'd deny it. Okay. Then we have the very first time you're checked in to the system. So the EMR, Electronic Medical Record System, will get the appointment ID from the user. So you actually have to tell the system, here's my appointment ID. The system would then go and say, give me the blockchain ID of the person that has this appointment ID. Then they update their system, and now everything's in sync. So this is a one-time deal. So a user comes in with some symptom that's common. He has a sore knee. You could have an application, analytics application that can look at all of the treatment paths for that patient, or you can look at all the patients that have that symptom, and you can figure out, is there a new analysis that you can be made to help shorten the time that the person is going to be seeing doctors. We're trying again to reduce costs. You could have some sort of a way to share the savings. So if you can find a way to reduce the cost to an insurance company, then they could see about giving the doctor some of that savings. So that way they could see a benefit. And so then the blockchain could help go through and figure out what's the best approach, and you could use the claims blockchain, completely separate from what I'm talking about, could actually show the savings. So this, again, it goes back to, it gives more ability to use analytics. So we can improve care by looking at past treatment paths not only for a person, but for the population at large. You can give doctors a new revenue stream, so researchers can have access to this data, and the doctors can make some money. You can, it gives the doctors a way to find more effective treatments because then again the shared savings. And you can then make certain that the data being shared is protected. Again, we go back to the data ownership. So no, I don't want my data to be sent to that pharmacy or that pharmaceutical research company because I don't like their business practices, so I don't want to help them. So I don't share my data. It's kind of simple. And that's it. So this is, I had done a proof of concept on this subject to, at one point, to look at, well, how can it be done? And I did this all with Hyperledger. And all my entire proof of concept dealt with the what was actually in the blockchain. I wasn't dealing with all the extraneous applications that had to be around to actually make this work because you have to interface with the doctor systems, you have to interface with the insurance companies. In this case, I don't think the regulators should be involved because they may not necessarily need to know this level of detail because we're not dealing with any money that would actually be in the claim blockchain where they would actually go through, well, we charge $500 for an aspirin, here's the information. That would all be in a different blockchain. So that's it for just my initial talk on healthcare and blockchain. Have a great day.